Hi, everyone. Welcome to Move More, Worry Less. I'm your host, Paige Festa, the founder and designer at 13 Fit Apparel. Today, I'm so lucky to have Melissa Capurro here, who is a physical therapist and the founder of the Stoic Physio. So, Melissa, if you'd like to say hi to our audience and give a little intro on who you are and what you do.
Yeah, sure. Hey guys, my name is Melissa. I am a physical therapist in the CrossFit space. I did not originally start in the CrossFit space. I started in an orthopedic clinic, and a few months ago, I left that job to work full-time out of my CrossFit affiliate. I work for a remote company that does a lot of injury programming for CrossFit athletes and active individuals. So I kind of do a little bit of both of in-person work and remote work. And it's great because my career and my passion and my sport are all the same thing. And it's pretty cool being able to have all those three things blend together, sometimes to a fault, but honestly, it's really cool having all those things be essentially the same thing.
That's so fun. So what got you into PT?
So I remember distinctly when I was younger, my dad and I were talking and he showed me the back page of a newspaper. And just a little backstory, my uncle is a PT out in Santa Monica, California. He works with Olympic athletes, famous people, you name it, like super cool job. And on the back of this newspaper, he showed me, it was like the sports section of the newspaper. And it was a picture of my uncle working personally with an Olympic track athlete. And her name was Jackie Joyner-Kersee. So I think she was competing in like the 1987 Olympics or something crazy like that. But he was working on her and it was literally the front page or the back page of the newspaper. So I saw that and I was like, wow, like I want to do that. That's going to be me when I'm older. And I still have the picture to this day. Like I found it and I downloaded it and I have it saved in a folder. And that's like my inspiration.
Really? Were you always into sports and fitness, or did your excitement about seeing like your uncle on the newspaper being a physical therapist and going down that road make you interested in fitness and sports?
So I've always loved sports. I grew up playing softball. I played field hockey for a very long time. I've always been involved in sports, but I knew that I never could really make a career out of me playing sports. So I was like, oh, I'm going to do the next best thing. And I'm going to help people that can make a career out of playing sports better. So that's kind of how I justified that.
That's awesome. And you said that you have gone out on your own and started your own business. So I would love to talk a little bit about why you decided to go out on your own and what the process looked like for you.
Sure. So it was tough because I really, really loved all the people that I worked with in the clinic and I learned so much from them, but I knew that I really wasn't happy doing what I was doing. First of all, I was working, 8 hours a day, normal day job, but I was required to see 2 people an hour pretty much. So on my heaviest days, I would see 16 people a day. I mean, not all of those slots were filled, but we could see anywhere from 12 to 16 people a day. That's a lot, and you're not really getting that one-on-one attention as a client or a patient. In addition to that, the insurance companies in these clinics, they kind of really operate what you do and how you do it. And they put a lot of restrictions on that. So by going out on my own, I give people one-on-one attention for the whole hour instead of, flip-flopping back and forth between 2 people. And I'm really able to treat the way that I want to treat. Not to really knock on my clinic at all, but I mean, the heaviest dumbbell was 25 pounds. There wasn't a barbell in sight. And I really didn't have anything to work with other than like BOSU balls and bands. And, while those are great tools, it's, if I work with mostly CrossFit athletes, a lot of my training and my rehab is going to involve barbells and heavier dumbbells and kettlebells and all that kind of stuff. So now I'm able to treat my patients the way I want to treat them. And it's going to be more applicable to the things they do in their sport anyway.
You mentioned that working with insurance companies, there's a lot of restrictions in what regard?
So they kind of put what you do in terms of like the treatments that you do, whether it's covered by insurance or not, whether they call certain treatment like a certain type of code, or if it belongs to a certain type of treatment. So insurance companies cover like certain treatments based on what you would classify them as. So I can really see a patient now and do whatever I want, whether that would be dry needling, if I want to do manual work, if I want to have them squatting, if I want to have them do like a full Metcon, like whatever I want to do with them, I can. Whereas with insurance, it's like, well, only some of that would be covered. Or, they put a limit on, how much you can do for a certain amount of time during that visit. So I'm really able to just dictate how I run my sessions as a whole now.
Right. That seems so not great for the patients. I mean, yeah. I definitely didn't know that. I've gone to physical therapy before under insurance, and I definitely could see that they're bouncing around to different patients. And I hardly spent any time with my physical therapist when I went, for 100%. And I actually remember, not to go off track, but I remember I was like feeling fine. And I asked the physical therapist, I was like, do I still need to be coming? And they're like, oh no, you haven't had to come for a while. You don't need to be here. I'm like, then why are you having me book this twice a week? But like, they didn't communicate with me or anything. So I don't know, that just seems frustrating to hear, because we, as just people who aren't physical therapists, go to physical therapists or professionals in the field, trusting them with our body. And then that's crazy that insurance can dictate what kind of treatment you can get. So it's like, are you really getting what you need to get? And are you actually getting better? And wow.
That's exactly what I'm saying. Like insurance, like you can have like 2 or 3 visits a week under insurance, but like, are they going to be filled with the things that your body needs and what you need to be able to get better? So, I mean, the biggest part of my job is educating, honestly. Like, yeah, there's a lot of exercise involved and loading and stuff like that. But the biggest part of my job is educating and making sure I'm making it clear for my patients as to why they need to come to see me, how often they need to come to see me, what they should be doing outside of coming to see me, and all of those other things that kind of come with it. Like, there are so many clinics where it's like the person comes in, they see the PT for about 10 minutes, and then they get thrown off to either like an aide or an assistant where they just have like a sheet of exercise. And it's like, okay, do A, B, C, and then you're good to go. So I don't have to do any of that now. I do it all on my own. Like the patient is with me for the full hour. And you can build a lot better relationships with people too. It's like, I know my patients. Like, it's not just like, oh, Susie's coming in at 2 and I have Bob with her at the same time. Like, no. Thank you.
Wow. It's crazy to hear it like that. Just because so many people, myself included, we go to people trusting them to make us better, and not that it's their fault, because obviously it's very much insurance driven, but that's really crazy.
Yeah.
I want to dive. What's that?
That's why I had to get out.
Yeah, no. And good for you for doing that. I mean, it's a big step to take to start your own business. I feel you, girl.
Yes, you do.
So I do want to dive into more, physical therapy specific to CrossFit in a moment, but I would love to get you to explain. What a weird way to say it, but have you explain? I don't know. Yeah. Let's talk about why you're the Stoic Physio. How about that?
Yeah. So I feel like a lot of people don't really know what Stoic means or what it truly means, because when you ask someone, what does Stoic mean to you? It probably means like emotionless or, not showing any emotion or just like any of that kind of stuff, like kind of turned off from the world. Whereas to me, like I learned about Stoicism and first got to use it and, apply it to my life when I was at the end of my PT school career. And this whole philosophy and way of thinking kind of helped me through the rest of my affiliations, my rotations, that kind of stuff, because PT school is the hardest time of my life. Honestly, like my program was 2.5 years long. It was shorter than most programs, but as a result, it was a lot more rigorous and they tried to fit a lot more stuff into that amount of time. So having this stoicism or this framework and philosophy that I could turn to that really focused on, making sure you keep your emotions in check, making sure that you worry about the things that are in your control, like those things really kind of helped me through PT school, because there were so many things that were out of my control. And, you just had information being thrown at you left and right, and, working full time and also doing school like that sucks. And it's really, really hard. And I took my licensing exam while I was still in school. So having all of that happening at the same time, like I needed something to really kind of help me along. So this philosophy or way of thinking of Stoicism, keeping myself in check and making sure that I'm keeping my eye on the prize and moving forward, like that really meant a lot to me. So getting to know that and, believing in that and studying Stoicism as a practice, like really making it a part of my everyday life now. I was like, what better thing to call myself than the Stoic Physio? So there birthed my Instagram. And then it was just kind of like, that's it. I'm just going to keep that name. So here we are.
That's so awesome. It's funny because to be perfectly honest, I had never heard of Stoicism. Like you said, most people think of emotionless. And when I hear Stoic, I'm literally taken back to my English class in high school, because we had vocabulary words. Stoic was one of them. And vocabulary was my jam. We used to have like vocabulary bees, and it was so much fun. I loved doing it was called everyday vocab, like things that you might see, but a lot of people don't know what they mean. Anyways, so I totally understand that that's what I thought. But then, I guess it was a couple of months ago now, we had a guest on the podcast, Tim Paulson, the CrossFitter, and he mentioned Stoicism. And that was the first time I've ever heard of it. So just kind of funny that the 2 times in my life that I've heard of it were from CrossFitters. Just interesting.
It does play a role. Like, honestly, if you are, and not only just in business too, or in my life, because there are definitely like real world applications to that philosophy, but like, if you're a Metcon and you're just like really struggling to make it to the end, like you turn on that Stoicism and you're thinking about like, okay, like, I've come this far, I've, done this, and I only have this much left. Like, it's going to help out. It's really going to sharpen your mindset. It's really going to make you a stronger person, and honestly, a better person. So it really does apply to the fitness world as well.
Do you have any recommendations on books to read about it? I'm super curious, and the more people talk about it, meaning you basically, the more I would love to read about it, or maybe, I don't know, explore it a little bit.
Yeah. So Ryan Holiday, he kind of does this whole thing with the Daily Stoic. So that's like his brand. It's a book, it's a podcast, it's a website. So that probably is the best resource for someone that's new getting into Stoicism, just kind of really figuring out what the foundations are, what it's built off of, just the basics, and then, branching out from there. And there are a bunch of resources on the website too about books to read. There are some really dense ones, like Marcus Aurelius. He has his meditations. Those are really, really old books that are really dense to get through and really hard to read. But then there are more modern day things that are more like, I don't want to say like affirmations, but are daily things that you can read and like immediately apply to your life. Gotcha. So for example, with my mentorship that I'm taking, they sent me this. And I was like, okay, if this isn't a sign, it's a sign. But it's basically 366 meditations on wisdom, perseverance, and the art of living. And every day it has a different quote and basically an explanation as to what it means and how you can apply it to your life. So that is Ryan Holiday and the Daily Stoic.
Okay. So I will definitely look into that. And you definitely had me at podcasts, because I'm always looking for good podcasts to listen to.
They're great because they're like 5 minutes long. So they're quick, easy, tangible things that you can do immediately.
Oh, cool. That's awesome. I'm definitely going to look that up as soon as we are done here. So let's jump into some stuff about CrossFit and about physical therapy. So I think the first question I want to start with is the kind of the most common reasons you are treating CrossFitters. Is it, for injury prevention, or is it for fixing injuries, or what is kind of, I don't know, the most normal thing that you see?
So most of the people that I see do have injuries, especially the people that I work with remotely are specifically seeing me because they have injuries.
Okay.
People in person, like sometimes I'll see someone once a month or so for like maintenance where they maybe previously had an injury and they're really not having any issues right now, but still need kind of touch points every once in a while to make sure we're on the right track and doing the right things. So, fixing injuries, healing injuries, definitely number one, but also maintenance for sure. With my remote clients, if we're actively working on fixing an injury and they're feeling better, then my programming can start to like work into more of like a maintenance phase or getting them back into CrossFit. So like, for example, if someone has shoulder injury and snatching sets it off, we can start to feel better and things are going well. Like we can start incorporating like some snatch work or, preparing them to get back to snatches at heavy loads, high intensities, that sort of thing. So PT can include some of those things in terms of like, we're reintroducing clean snatches, squats, all of those things. So that's all part of it. So really maintenance and I would say fixing injuries. That being one.
What is the most common injury among CrossFitters?
Yeah, so this is a fun one. I would probably say low back and shoulder. There's a lot of knees in there too, but I would say shoulders and low backs really kind of take the cake. We have a lot of overhead volume in CrossFit, a lot of overhead pushing, a lot of overhead pulling. So it's pretty, if people aren't used to volume in certain movements, like that's an easy time to get like a pretty good overuse injury for your shoulder. Lots of squatting volume. So if you have a lot of squatting volume and not a lot of hinging volume, sometimes people's backs tend to kind of flare up a little bit. And that's kind of like a whole nother point that I could get into and get down a rabbit hole. But, a lot of people's back pain too isn't necessarily related to a certain injury. Sometimes it could be just a response to overtraining. So both of those injuries are really interesting to me because I love the shoulder. I love overhead athletes, with CrossFitters being my number one interest. And, low back pain is always so interesting because there's so many different things that contribute to it. And it's really different for everybody. So I would say those two are probably the most common.
I would love to go down your rabbit hole. I'm really interested. My guess was going to be shoulder injury. So I was almost right. But lower back pain, I think, is a really interesting topic because, like you said, it can be so many different things. I mean, we don't have to go too heavily into it if you don't want to, but maybe just kind of unpack that a little bit. Tell me a little bit more about lower back pain, what could be causing it, and all of those things.
Yeah. So, wow, there's so many things I can say about that in terms of causes, because like I said, it's really different for everybody. But for example, in a CrossFitter that normally is training 5 to 6 days a week, and is really not limited in any of the movements that they're doing, but they're having back pain. Like, one of the things I'll look at how often they're squatting, how often they're deadlifting, and then compare the two. So if one's really off in terms of how often they squat or deadlift, that's already kind of like a discrepancy that you're going to want to really pay attention to. Mm-hmm. And if their back squat and deadlift are like super, super far off from the percentages that they should be. So I think your back squat should be about 80% of your deadlift. If those percentages are really, really mismatched, that could be a huge kind of red flag as well.
So sorry to interrupt you. So what does that mean? What does that mean is happening in the body to cause back pain if the percentages don't line up, or if they're squatting more than they're deadlifting? What's going on?
Usually a muscular imbalance. So most, just say for today, back squatting or front squatting, either type, we'll call it anterior chain, and then we'll call your deadlifting posterior chain, right? So if you have an anterior chain dominance and you're not really paying much attention to your posterior chain, it's going to get weak. It's not going to be getting the same stimulus that the anterior chain is getting, which would be the front of your legs. So that could potentially cause issues and cause back pain. In addition to that, for example, if your back squat, for example, is 200 pounds, your right and left leg could be significantly different in the amount of strength that they have. So say your left leg is contributing 30% and your right leg is contributing 70%. That there too, like single leg can be contributing to back pain as well. Because if you have one leg that's working a lot and the other one that's kind of just like along for the ride, that whole side's going to get overworked, overused, and you're going to have issues which can travel up to the back. So a big thing that I like to look at with CrossFitters is muscular imbalances in that regard, because usually there are some pretty big imbalances that are present in those types of athletes, more so than just like, okay, you're going to do some core exercises because your back hurts. Like, yeah, sure. Maybe that has to be incorporated, but usually there's some sort of big glaring kind of like discrepancy, or they're just training too much. Like there are some clients that I had in the past that would be training like 4 to 5 hours a day, 5 to 6 days a week. Like that is just like, depending on what your goals are, like for someone that's trying to get to the games, like, yes, you have to be training a lot. Your body has to be used to that type of volume and it has to tolerate that type of volume. But if your body's not accustomed to that volume and you're giving it that volume with little to no recovery, which is a big thing, you're going to have issues and it could manifest in your back. And, kind of going back to my volume comment, volume is a good thing as long as it's good volume, as long as it's not like shitty volume. So, for someone, like I said, that has like goals of going to the games, volume is good and they need volume, but not without appropriate rest, recovery, and recuperation. So all of those things are going to be really important, especially in people with injuries.
So how do you figure out, like, is that a thing that one leg can be 30% of doing the work and one is 70%? First of all, that's bananas. Second of all, how do you assess that and figure that out? I would never think it was that much of a discrepancy. You would think, I don't know, maybe like 40, 60, 30, 70 is
real bad. Yeah. And honestly, like I realized it was a thing when I tested myself. So one of my favorite tests to use is like a front rack step up. So if you have a barbell loaded up in the front rack, holding it this way, and then you're going to step up onto a box. What happens is you can test the right leg, do as many reps as you can with one weight, as many reps as you can on the other leg with the same weight, and then compare. Mm-hmm. When I first tested this, I think I did 70 pounds on the bar. I did like 3 on the left and 7 on the right.
Wow.
Like I was like, this is pathetic. Like, what am I doing with my life?
Wow.
So, okay, this needs to change. I didn't have any pain. But when I started working with the remote company that I work with, Active Life, I kind of put myself through the testing to see what it was like, because I knew I was going to be giving it to my clients. So I did it to myself, and that was very eye-opening for sure. I didn't have any issues, but again, once I started, incorporating single leg exercises and really taking care of that left leg, like my squat numbers went up, my deadlift numbers went up, like everything just felt more balanced too. So it's really cool because people usually don't think about PT being things that you would enjoy doing. But us CrossFitters, like if you were to be given something with a barbell, you'd probably want to do it for your rehab, right? So it's kind of cool that I'm able to do that with my patients and my remote clients too.
Yeah, that step up test. That's on my list of things to do this week. That's super interesting. I love that. What are the most common mistakes you see CrossFitters doing? I know you mentioned volume and doing too much volume for what your body is prepared for. Beyond that, unless you want to go further into that, you're more than welcome to. But beyond that, are there other common mistakes that CrossFitters might not even realize they're making?
Yeah. So what's the best way for me to say this? Like, less is usually more. And like I said, volume is really important. And I get that. And I'm a huge proponent of volume, but for people that don't realize what extra shit volume can do to your recovery and your body, like that's a huge thing that people really kind of need to realize, especially, like I said, without appropriate recovery. So when I talk about recovery, making sure that their diet is on point, their stress is in check, and their sleep is in check. So, 7 to 8 hours a night of sleep, managing your stress well, doing journaling, getting into Stoicism, that kind of stuff, like doing things other than working out to manage your stress, whatever that means to you, like doing things that you love, reading, whatever. And then diet. Oh, So for someone that is working out for as much as us CrossFitters do, especially for the ones that love to do extra volume, it's really important that they're eating enough. So specifically for me, like when I started CrossFit, I definitely wasn't eating nearly enough. And not like I had a weight issue, but I wasn't giving myself the appropriate calories to heal myself and make sure I was building muscle and strength and everything like that. Like I wasn't giving my body the resources in order to improve. So I think people have this idea that they need to like eat less, really, when they need to eat more and fuel themselves better and with higher quality. So if they don't have those three things in check, then they're really going to be suffering, especially if they're doing extra volume. So I would say probably the biggest mistake is that extra volume without appropriate recovery. So
valid. It's interesting because I completely understand being in the mindset of like, let's just do as much as we can. And because back when I was living in New York and I was doing CrossFit, I was teaching cycling, I was running myself into the ground. I was exhausted all the time, but I was like, but if I don't do this, I'm not going to get stronger. I'm not going to get more fit. I'm not going to XYZ. But really all I was doing was hurting my body and like completely wearing myself out. And I was holding on to extra body fat and I was tired. I was sore, like, and it's really easy to get trapped in that when you love doing that. Like you said, like CrossFitters, we love it and we want to do it and we want to do more of it.
Yeah.
But if you're not recovering properly and just to go back what you were saying about less is more, since I moved out of New York, I have cut down my volume significantly. And it's just amazing how much different I feel.
Yeah.
Yeah.
So that is definitely like, and a caveat to everything that I'm saying here. Like, I'm not saying that volume is bad. Like for a third time, I will say that I like volume and volume is great, especially for the people that have competitive goals. Like for example, I have competitive goals and I have a coach that programs for me and he programs me volume. And I try to do, class from my gym on top of that too on some days. So there's volume right there. But like I said, if you're not getting the appropriate recovery, it's just not going to work. And then you're going to create an injury on top of that. So that alone, not recovering with high volume is normally how injuries happen. So making sure that I cover that with all of my patients and my clients, that is like paramount, especially to the ones that are training so frequently, because that's really where the issues start, is if they have an imbalance between their volume and their recovery, that's where it all happens.
Right.
People always think it's like the last rep of something that like puts them over the edge, like the last deadlift, the last pull up, whatever, but it's usually not any of that. It's usually before that happens, what's your lifestyle like leading up to all of that? Like, did you sleep last night? Did you eat like what you were supposed to eat in terms of volume? Like, are you stressed? All of those things combined together going into a workout where there's high volume pull-ups or deadlifts and you already have kind of like a nagging back or shoulder thing going on, like it's probably not going to end well.
Right. CrossFit gets a pretty bad reputation. And I would really like to talk a little bit more about that. A lot of people, especially people who have never done it or seen it, they're like, but isn't that so dangerous? I would love to dive into that. I know you have a lot to say about that. So let's talk about why people think it's dangerous, if it's dangerous, why it has a bad reputation, all of it.
Yeah. So CrossFit is not dangerous for all of you out there. Just general info, like CrossFit is totally universally scalable. And this isn't coming from me. This is coming from CrossFit as a brand that says like pretty much anyone from, a competitor that's 25, 30 years old to your grandmother who could be 80 years old, the same workout can be scaled in different ways. So you both, anyone in between on those ends of the spectrum can really do it, right? So, there are movements for everybody in CrossFit. And I think people really it gets a bad reputation because of how so many people think everyone's so injury prone and everyone gets injured in CrossFit. Oh, you got injured in CrossFit? Oh, no wonder. But in reality, last time I looked at the research, I think there's 2 injuries per 1,000 hours of training. Like, think about that. What is that? If you do one workout a day for a year. So that would be 365 hours if you do a class setting. So it's 365 hours. That's a little over a third of 1,000 hours. So if you think about it, 2 to 4 injuries, and it depends what they call injuries, right? Like, is it a full-fledged, like, do you really injure yourself? Or is it like, oh, kind of tweak my back, kind of tweak my shoulder, whatever. That's really not that much. And compared to other sports, it's the same. And it's even a little bit higher in running. So in terms of CrossFit compared to other sports, the injury rate is not any higher. And it really does come down to, do you know your limits? Do you have a good coach? And are you going through some foundational program? Like a CrossFit gym that just throws you into classes, I would kind of be weary with, only because there are a lot of foundational movements and patterns in CrossFit. And if you don't really know them, or you don't have any experience with them, just throwing you into classes isn't a good idea, especially with a bunch of people that are doing the movements, whereas you may be kind of just like with them the entire time. But people that are new to CrossFit or may, be just starting, like, you need some attention, like you need to learn the movements properly and all that. So having a good foundational base is really important too.
And that kind of segues me into 2 of my next questions that you kind of answered, but maybe we can go into it a little bit more. But for somebody who hasn't tried CrossFit or wants to try CrossFit, what's your advice to them? And for being a new athlete, what should their focus be when they're coming into the gym?
So be choosy with your gyms. Really find a gym that's going to focus on, making sure that you get the basics down before really progressing into any of the higher level sexy stuff per se. So making sure that you get a really good foundational base there, have a group of coaches that really support you and know what they're doing and know what you're doing. And as a new athlete, it's going to be really important that, going back onto what I was saying in terms of the foundational movements, making sure that you get a really good foundation, but making sure that you do those really, really well. So making sure that your form is really good, making sure that you understand the different movements that are used in CrossFit and, how often you should be doing them, just a general idea of, what these movements are and just competency that you can do them well in a class setting before going into classes. So I would probably say that form is really important, and making sure that you have, like I said, a supportive gym, supportive coaches that really have your back when you're getting introduced into the sport.
I love that. And I've never coached CrossFit, but I used to coach indoor cycling and circuit training. And that was one thing that I always said was focus on your form and the strength will come. Like, don't worry about the weights, like make sure you have the movement figured out. Cause it's so easy, especially going into a group class setting, seeing other people doing the quote unquote sexy stuff or the heavy stuff, or they're like, oh, go heavier, go try it. But really at the end of the day, like, know your movement.
Yeah.
And eventually you'll be able to add the weight. And I think that's kind of part of why CrossFit does get a bad reputation too, because a lot of times, like you're saying, if you go to a gym that doesn't really have a great foundation in that way, they're just pushing you to, put on weights and do all this crazy stuff. And you've been doing CrossFit for 2 weeks and you're already doing handstand push-ups. And it's like,
what the heck? Yeah.
But like, it's, yeah. So, I love that. I think that's so important. And that leads me
to just before we go on.
Yeah.
I think the best and most important part is like the coaches that can like look at you either squatting, deadlifting and point out specific faults or like mobility deficits, for example. Like those are the coaches that you want to stick with, because those are the ones that are going to help you just improve the things that don't necessarily like, they have a bearing in how you perform in your sport, but it's going to help you in other ways as well. Like fixing problems that don't necessarily like really have anything to do with the gym, but maybe you have a mobility issue in your ankles or your shoulder, for example. And because of this, you can't, squat down properly and it affects your form, or you can't reach above to like a cabinet on the 3rd shelf and it hurts you every day. Like the coaches that can identify those things and really point that out to you and then point out the why as to yeah, this is an issue in the gym, but it's also an issue outside of the gym. So I should fix it. Like those coaches are going to be the ones that you're going to want to stick with.
Right. And it's like you're reading my mind about every question, but you also know some of the questions that are coming because you keep mentioning things that are going to be like in my next question. I would love to talk a little bit about mobility because I feel like mobility is one of those things that we all say we need to work on and want to work on. But when it comes down to it, when we give ourselves, an hour at the gym, doing the quote unquote sexy stuff is going to be a priority over mobility. So first, I'd love to talk about the importance of mobility, which you've already kind of touched on here, but also easy ways for people to incorporate it into their daily routine without it being a hassle or without it feeling like it's taking away from their 1 hour at the gym, just so they can, be a little more mobile and enhance their life in that way.
Yeah. So it's kind of hard for me to, just in terms of like general advice with like mobility, like part of what I do is not giving out like cookie cutter, like, oh, do this, this, and this movement. Right. So something that, I really harp on is like, do you really need mobility? And the answer very well could be, yes, you need a lot of mobility, but it's really dependent on the person. Like if you have all the range of motion you need, do you need to be spending your time on mobility? No, because you already have it. So why waste your time? For the people that do need mobility, then yes, I would probably get with a coach or someone that's able to assess you, and they'll be able to come up with a regimen that would be helpful for you and wouldn't take too much time out of your daily routine. But just something generally that I really like, just because I think it's pretty cool, is I would try and, start small, start really like with a little bit of time, but I would accumulate time in the bottom of a squat. You'd probably be surprised about how hard it could be for some people. So, start out with 2 minutes and work your way up. And it's kind of cool because you can do a lot in that position and our body is supposed to move in that way. So that's just one kind of little thing that you could do. And just, at max, like 5 minutes a day, like it's only 5 minutes out of however many minutes we have in a day anyway.
I've definitely sat at the bottom of a squat though, doing Ramwad, and even for like a minute or two, like, yeah, it can get spicy fairly quickly. The other thing that I love that you said was, because I've never heard anybody say this ever, is that you might not need to work on mobility. That's
something that I harp on all the time. Like that's why I assess my patients and my clients the way I do, because if you have the correct mobility for whatever you're doing in the gym, I'm not going to spend time mobilizing you because that's not going to fix your problem.
Right.
So if you have a mobility issue, then yes, it's something worth addressing, and it's going to be low. It's going to be high on your low hanging fruit in terms of what's going to be important to address. But if you have all the appropriate mobility to do the things you need to do and you're still injured, then mobility isn't the problem.
Wow. I love that. Would you mind defining mobility versus flexibility?
Yes. So mobility is you being able to actively move through a certain range of motion. So that's getting into a bottom of a squat, that's using the range that you have. Whereas flexibility is like your passive, can we get your shoulder, up all the way? Can you, if you're laying down, can you touch the floor with your thumb? That sort of thing. So flexibility is just the range of motion in your joint. Do you have it? And then mobility is you being able to use it appropriately.
How do you apply that into like your life and in fitness? Like, is flexibility important, or I don't even know how to ask my question. Yeah.
So think about it in terms of a squat. So like one of the flexibility tests that we would use is a supine hip flexion. So laying on your back, can your knee come into your chest and basically make contact with your rib cage? If yes, then that's full range of motion. That's great. But then can you control that range of motion when you squat? So you could have full range and that be great, but that doesn't mean that you can control all of the movements, right? So like you may not be able to control a squat. You may not be able to control a loaded squat for various other reasons. So, whatever that is, like you have the mobility, and there are other mobilities required to be able to squat appropriately, like being able to have the appropriate amount of dorsiflexion in your ankles and a certain amount of, knee flexion, but that's not as much important. It's really about your hips and your ankles. If you can't control that range of motion, that's your mobility right there, and being able to actively use it in a motion like a squat, motion like a hinge, like that sort of thing.
Interesting. I always get hung up on mobility and flexibility. And it's one of those things that I Google often because I'm really good at learning stuff and then forgetting like half of the facts. So then it doesn't stick with me. Let's wrap it up with one kind of, and I get it that each client and every person is different and it's all based on what their body is capable of or whatever. Yep. But as like blanket general injury prevention for our listeners, what are your like top 3 things that people should be or try to do every day just to keep their shit together?
Yeah. So I'm going to go back to my recovery things because like I said, and like you said, it is going to be really different for everybody depending on what you do, what your body's like, what your strengths are, your weaknesses are. And in terms of that, one thing that we can all do is make sure that our stress, our diet, and our sleep are in check. That's going to be the same with everybody, right? And making sure that you optimize those things because those are always going to be in your control. Going back to the Stoicism things, those are things that you can actively make a difference on. And the more that you put effort into those, the more your training is going to improve and just support you in life in general. So, going into injury prevention, like it's really hard to prevent injuries. Like it's really hard to prevent one instance from happening where you may have, if you hurt your back during a certain, movement, like I said before, it's about the lifestyle that happens beforehand. Like it's really hard to, prevent a traumatic event from happening, right? So you can't prevent injury that way. But injury prevention, in my opinion, really comes from those 3 things: your stress, your diet, and your sleep, and just making sure that your volume is in check, making sure that you're doing those 3 things to kind of optimize your recovery. And it will definitely optimize your training as well.
I think that's fantastic. And it's so important. And I'm glad that you've said it more than once that, it's not just about working out or mobility. The recovery is where you get stronger, and it's just so important. So I am so grateful for you, Melissa. Thank you so much for joining us today. This was so much fun.
Absolutely, Paige. Thanks so much for having me. Yeah, I was like really looking forward to this the entire time. I was like, oh my God, I can't wait to chat and say all
I know. I was so excited to see you again. Yeah. So for all of our listeners today, we are giving 20% off at 13fitapparel.com using the code Melissa.
Oh my gosh.
Yeah, 20% off the code Melissa, MELISSA. Feel free to use the discount code and we'll talk to you guys next time.
Bye guys. Nice talking to you.
Thank you so much for listening to today's episode of Move More, Worry Less. If you love this episode, please subscribe, share, rate, or review us to help us grow our mission. If you don't already, follow us on social at 13fitapparel and visit our website at www.13fitapparel.com. Thanks for listening.